The Prisma Health Education and Research Institute supports the education and training of the future healthcare workforce, and along with that, the recruiting and retention of that workforce. And the Institute also supports applied research to optimize the health of our patients and the communities that we serve. We have over 8,000 students coming through our clinical learning environment each year and strong partnerships with a variety of academic partners. And we saw the need to establish this entity to leverage those partnerships and to oversee and coordinate both the educational and the research activities that are ongoing.
Prisma Health Education and Research Institute, I like to look at as being a culmination of inquiry, where we have those who are dreaming of what they can be, to a connection point in how they can have exposure and experience. So our mission overall is to ensure that we are creating pathways as well as clinical learning environments that would encourage educational opportunity, whether you are a rad tech to a medical student who's dreaming of providing primary care, to that nurse who will be working alongside both and providing guidance and feedback. So our mission overall is to ensure that we are providing innovation, experience, and exposure.
One of the incredible realities of working at Prisma Health is this rich ecosystem, right? We have an incredibly effective, large healthcare system and equally internationally known powerhouses in education. We work with University of South Carolina, we work with Clemson University and Furman University, all with unique strengths. We work with our incredible community colleges that are second to none in terms of Greenville Tech and Midlands Technical College and other colleges. Because we have all these assets, we can really pull upon the unique strengths of each of these institutions.
The benefit to us having the PHERI collaborative efforts, the perfect example is utilization with our simulation centers. I always call that the safe space to make mistakes. It involves our learners being able to come into the footprint and really work within areas that are truly a visual of our clinical learning environment if they were in our hospitals or in our ambulatory care settings. And they're able to really be able to practice what patient care is. Another aspect of development tied to that is if you're looking at our human factors. That's where we go in and we kind of test what we're doing and we ask the question and we look for continuous improvement.
Human factors really is that area that addresses the interface between humans and machines and teams in how we can improve quality and safety and efficiency of function. This collaboration has the promise of transforming care across all of the areas of Prisma Health, from the operating room to outpatient settings.
We're always asking how we can do better. So you affect change by being able to assess, reset, and push through. And in the simplest of forms, that's why we have our research, where it's clinical trials related to industry, our partnerships that we have with public entity, whether that's federal, state, as well as our philanthropic community that really looks at areas of interest that impact various demographics across our state. And we work to answer those questions. And accountability is a very important piece to that. So we're always asking questions early and often and testing those within the footprint that we have within the Prisma Health system.
We've come a long way. Even in the last 5 years, we've had incredible growth. You look at the number of studies that we're currently doing, over 1,600 studies, or 6,000 active research participants, the number of grants that we've received every year now, $50 million in awards. Our clinical revenues at an all-time high. We've had over 400% growth over the last 6 years.
I see our Education and Research Institute being a leader in clinical trial space within the Southeast region, I believe we will be recognized from a national perspective as it relates to our human factors engineering initiatives that equate to quality care. I also see us being a good model as it relates to others looking at us and how strong partnerships could be from the nonprofit. So we're always looking at how we can have bi-directional partnership to ensure that we are uplifting missions of others whom are within our community. The best way to get information related to PHERI is to look at our website. Look to see and search around and see what type of information kind of resonates with you. Once you have done that, please reach out to us and we're more than happy to speak with you.